My name is Tim Lauzon, and I am the Health and Safety Officer at the Greater-Essex County District School Board. And actually, I've been there for 13 years. Shortly, I'll be starting my 14th year. It's important to understand for school boards, it's a collaborative team effort. So health and safety starts at the top and works its way down. So it's really the employer to the supervisors to the workers, and it transcends across our system, including our union partners. And it's been and continues to be the goal and objective of the employer, of the board, if you will, to keep health and safety not only compliant, maintained, but take us from the past through the present to the future. And in a lot of our documents, if you research our school board through our portal, our web page, our health and safety policies, management programs, you will often see referenced it's for a healthy and safe working and learning environment is part of our motto. It's been a fantastic experience at the school board. When I started back in 2000, there was very little in place, so it's been wonderful to kind of start from scratch and to build things, to put them in place, and to keep up with legislative changes. So I would answer this in kind of three components. The first one is, where have we been? Where have we been is developing our policies, management programs, and across the, not only just health and safety, but designated substances. And so you get into asbestos and WMIS, emergency response, fire, workplace violence. So getting all these things developed, these programs in place. We've also gone from multi-site to site-based, which was a tough transition, but a great transition for us. So that's the past. The present, where are we at the present? The present, we're currently in the last 3-4 years have been fantastic for us, because it's not only keeping up with changes to legislation, but it's also been developing these programs, getting new programs in place, and technology coming into our school board has been fantastic. So going on to things such as the portal or professional online development such as the pod, so introducing technology into health and safety and tracking and training, and that has really grown our culture, tying it to site-based. So that's the present. And if you look at legislation such as health and safety legislation, Ontario Fire Code, health unit legislation, it's all site-based. So our site-based model and philosophy has really helped develop our health and safety culture at the school board. For the future, there's big plans coming too. So we're changing the culture, and we're engaging not only our staff, but our students through our staff. Health and safety legislation such as the Act is really based on the employer, supervisor, workers. We're a school board, so to engage the bulk of our workers, which are teachers, you have to also include students. And within the last year, we've added students to our health and safety policy. We've also done a lot for our program department, and getting them for training for our co-op students, preparing them for the future, involving them in our health and safety training and our programs and certifications. So we've engaged our teachers, the bulk of our audience, through their students. And again, that has led to another culture shift for us for embracing health and safety, which is reflected in our accident injury stats and the wonderful decrease we've been experiencing. Some of the bigger ones that are detailed is, and you have to have this under legislation, it's Section 25(2)J. So you have to have not only a health and safety policy, but you have to have a management program to carry out the policy. And we struggle like any other employer or school board across the province. It's great to develop your management program, and of course you train people in it, but if you don't keep it alive and keep it going, so what we do, which is a lot of people don't do, but we do it, it's called an accident injury prevention plan. So that actually puts wheels on your program to keep it alive and to keep it going and to keep people informed. It promotes your internal responsibility system, and it promotes ownership and awareness. And that's how you grow a culture. So we've been doing that, and we're one of the only few places, well, actually, I'm not aware of anybody else who does the accident injury prevention plans on an annual basis. So we do that, and we monitor our stats to plug together our prevention program so we know what our targets are. That's part of our health and safety policy, and that makes us very unique. So that actually is one of the catalysts we use to keep health and safety alive and going. So that's our health and safety management program. Our asbestos management program, we also update and maintain each month. So many sites come up that we maintain. So not only have we developed programs, but we've been allocated the resources and the time to sustain them. And that's usually where health and safety goes off the rails because you don't sustain your programs. Women's management program is also a tough one, but we sustain that. We have a chemical inventory of around 3,000 chemical products in a typical high school. That is a lot of chemicals. So how do you keep people safe? How do you keep your safety data sheets up to date? How do you keep your personal protective equipment in place and safety practices? It's working with our program department, our science, which is part of science department, and tech, and all of our partners to keep that updated and maintained. You go into other programs that we have, such as workplace violence, which is Section 32 of the Act. Our workplace violence prevention management program, believe it or not, the Ministry of Labor in Windsor-Essex helped us write this program, and it is, quite frankly, one of the state-of-the-art programs. In fact, we even have the Elementary Teachers Federation of Ontario, which is referred to as EDFO, actually helps promote our program to other school boards across the province because that's a partner of ours that believes in our program and how well it is. So those are great accomplishments. Those are great programs that we've developed and we've put in place. The Emergency Response Management Program, we also promoted to other agencies. It's one of the better ones. Not only are they good programs, we exercise them, we also make improvements to them to sustain them. The Public Services Health and Safety Association, and prior to their amalgamation they were known as the SAO, but they've been with us for the entire time frame. In fact, my first day of work, so let's say November 1st, 2000, my first day of work, Ed Hager from your association stepped into my door, was one of the first people I met. And Ed's been with me the whole way through and assisting and helping as a resource. In fact, the Public Services Health and Safety Association has certified for health and safety level 1 and 2 about 525 people in our system. So when you consider we have 4,700 workers at 90 work sites and we have 525 certified, that is a nice percentage of our population, both management, supervisors, and workers, that are trained to a level of competency in health and safety. And your agencies helped carry that out, as well as consultation for all the programs I just mentioned. I've invested a lot of time and resources. To be a good health and safety officer, you have to be passionate about what you do. And any career that anyone chooses to be good and successful in your career, you have to have a passion or a love of it. With respect to the investments, obviously I'm hired and I get paid, so I get a paycheck to do the job. But the investment has been a lot. The school boards afforded us more resources, so for the 13 years, it's been a one-person department. Now that I'm going into my 14th year, we're now at 2.5. I now have a 0.5 clerk and a second safety officer, which is going to ease up my time frame and help us move forward. Lots of positive feedback. There's a number of measuring sticks to determine how your culture has grown through surveys, as well as through word of mouth and through asking questions, and even looking at enforcement and looking at accident injury stats. So I'll just reference a couple of those. With respect to determining if your culture has grown, one of the measuring sticks is have you had a decrease in accidents and injuries? Our school board in the past 2 years, so 2012, 2013, has had a 25% decrease in accidents and injuries. These are specific medical and lost time accident injuries, which we refer to as OSHA reportable, Section 52 of this wonderful green book. So one of the arguments you get from that is, oh, well, maybe that's because people aren't reporting accidents and injuries, therefore you're seeing a reduction. I am happy to report that we have more things being reported now, and our stats show that. It's just the seriousness of them has decreased. So your actual accidents and injuries versus near misses have had a 25% decrease, which is fabulous. That's good news for us. So that shows you're having fewer accidents and injuries, which means people are more aware and implementing more safety precautions. You also have other measuring sticks you can utilize. Those are the workplace safety inspections. Are you finding more items or less items? Your Joint Health and Safety Committee minutes. Now we're site-based, so we have 90 Joint Health and Safety Committees, which is 278 people on Joint Health and Safety Committees. That's both management members and worker members. So that's a lot of people doing health and safety. They're doing it every month, plus your quarterly meetings. In addition to that, we have a first aid management program. And we have not only a designated first aider at each one of those sites, but also an alternate. So that actually equals 180 people doing first aid on the quarterly checks, as well as available to service not only workers but students if they're injured. So we've absolutely had a health and safety culture growth. People are more aware of health and safety now. Health and safety actually isn't looked upon as something negative or something that you tick a box that you did it and you walk away from. People use it every day, and it continues to grow, and it's been through a positive enforcement through the internal responsibility system, and it's slow growth, but it certainly is taking place. Growing the culture of health and safety awareness through your internal responsibility system. So it's making sure that the employer, and in our case, the employer are the superintendents, the director, and trustees. In school boards, a lot of teachers or support staff, in a lot of cases, don't even know who their employer is. If you ask in a typical school board some people who their employer is, they'll say the Ministry of Education. That's incorrect. Your actual employer at a school board is the superintendent, the director, and the trustees. So in getting your culture change in place and implementing this, it's always top down. So you have to get the employer, in our case it's those three groups, aware of what they're responsible for. And we've been able to do that. We've been able to train our trustees. Our director and our superintendents are all certified in health and safety, which that's an incredible feat to do, and that also shows buy-in, support, and that's what you need. In addition to that, the supervisors in a school board are the principals. As your typical school is a principal, vice principal, their management. They meet the definition of a supervisor under Section 27. So they are the workhorse that carries out health and safety. The employer has to have policies, procedures, and programs and training in place. The workhorse that carries them out is the supervisor, not the health and safety department or the health and safety officer. We're the resource to help them if they have questions or to help get things in place and to help sustain them, but we don't actually carry out all the prescribed duties. The supervisors are the workhorse, so when you have them motivated, educated, and you've given them the tools to do their job, that again further grows your culture and it helps ensure compliance and you have things in place. And of course, educating the workers to understand their duties, their rights, their responsibilities. They are the people that are the ground running people. They see the hazards, they know the problems. If they are reporting them to your supervisor then knows they have to address them. If that works, ideally, the long-term goal and objective of employers should be to eliminate the jobs of health and safety officers and WSIB officers, because if everything worked the way it's supposed to work, we'd be out of business. Each school board is unique. The advice I could give them is keep slugging away, build that culture. Continue to get the support from trustees, directors, superintendents. They are the employer. They have to know what they're responsible for. They have to be able to provide health and safety departments with the resources necessary to assist all parties in carrying out their duties. And for other school boards that I work with, they have the same struggles that we've had and have. So it's where you've been, where you are, where you're going. We share the same struggles. So I would love to see more collaboration with the school boards. That's something that I'm actually working on with several of my partner school boards in my local area, is setting up regular meetings and sharing resources. What you have happen, and even your organization recognizes this, is a lot of school boards historically work in isolation. So they come across a problem, they develop a policy and a procedure to deal with it. It's not shared, and then down the road another school board comes across the same problem. They develop something, or a new piece of legislation comes out. Oh, okay, we have to develop, in order to comply with this, a whole new way of tracking training, or we have to do some mandatory training in this and this. Each school board will go and spend the resources and the time to develop their own thing, rather than, hey, you develop it, share it with me, and I'll tweak it. Or, hey, I've done this, I have it, here it is to the group. You just need to tweak it to make it workplace and site specific. So it's not all cookie cutter, but a lot of the work can be split up and shared, and sharing of resources is something that we need to take a better look at from a provincial point of view. If you think about the dollars and cents, the Ministry of Education, they're looking to save money, they're looking to better spend money. Well, that's a great way, and that transcends not only through the Ministry of Education and educational institutes, that you can share anywhere. And that's something that's missed, in my opinion. Proud of a number of different things that we've done, but one of our big turning points that really stands out is when we transitioned from multi-site joint health and safety committees into site-based joint health and safety committees. That was one of the major catalysts that allowed us to get to where we are, simply because of the fact that you're going directly to a site-based formula, which quite frankly is the true intent of the Occupational Health and Safety Act, Section 9. So we went site-based, and we actually went beyond the requirements of the Act, because we made every one of our work sites a site-based joint health and safety committee, regardless of the number of workers. So you either have a committee of 2 or 4, nothing more, nothing less, which not only meets this, but in a lot of our cases, because we have small sites, where in some cases you're under 5 employees, we still have a committee in place. So it's standardized health and safety for us across the system. And site-based has helped us not only standardize health and safety across all of our sites to make it consistent, it took power back to the principal, who's the supervisor under Section 27 of the Act, who's the workhorse for carrying out health and safety in the workplace. So you now gave back the resources, the tools, and the power and the duty to the supervisor of the site, being the principal, and you've empowered that site to self-sustain. So the workers at that site, they have a vested interest, they have a working relationship with the principal, who's the supervisor. You now have a team at every one of our workplaces with a vested interest in health and safety, and not only doing the monthly inspections, but talking about it at monthly staff meetings, sharing resources, sharing statistics, talking about accidents and injuries. They also talk about, in their quarterly minutes, they talk about workplace violence, so that includes your notifications of risk. Legislation itself, and not only in the Act and all the things we have to have in place, but in other branches of government and their pieces of legislation, it is all site-based. So you're going back to the true nature and the true design and intent. So each site has its own site-based asbestos management program, its own site-based fire plan, its own site-based emergency response plan, its own site-based workplace violence management program. So why? Because each site is unique. You can't blanket each site with fill-in blanks. Here you go. Although this assessment's from another site, you use it here. It doesn't work that way. Each site is unique. It has their unique hazards by design, by the environment with which it is located. And so for our school board, you're talking 90 sites across 9 municipalities, including a school on Pelee Island. Life on Pelee Island, it may be different from a school located downtown Windsor. So you'll have different unique hazards just based on geography, not only building design intent. And of course, you take an old building and a new building, you'll have different things and different hazards that are present. So that is one of the biggest things that has helped us move forward. And it's a great venue, if you will, or a vehicle for us to have grown our programs and to consult and to get buy-in and to move forward to create and update our programs, sustain them, and implement new programs. They have a lot of great resources that are available. It's communicating that and kind of re-engaging school boards. They have been with us through thick and thin as we move forward. So not only in the past, but in the present, and they're going to be with us in the future. They've been a great resource to help us not only implement our site-based committees, consult and help us with management programs, and also getting into new items or new areas such as mental health, as well as anti-bullying, or one of the ones we're working on right now is, its nickname is Project Sandbox. So school boards are familiar with, and even the general public is familiar with anti-bullying for students. But what about anti-bullying in the workplace between workers and supervisors? So that's a new one that we're tackling. And Public Services Health and Safety Association actually has a number of resources that we're utilizing there. Some of the markets, I think, that are untapped is tying into new legislation. Currently, there's Bill 147 before the legislature, which will change the definition of a worker under multiple pieces of legislation, including the Act. And what you're going to have there is volunteers will meet the definition of a worker. So will co-op students. Well, guess what school boards do? School boards have a lot of co-op students. And what we just started doing this year, and we are developing the partnerships with Public Services Health and Safety Association, is training our co-op students in health and safety, not only our programs, but linking them to where they're going to be going and trying to customize those. And we just built that partnership with our program department, our facility services department, and agencies such as the Public Services Health and Safety Association. And I think that is an untapped market that is just coming to be, that Public Services Health and Safety Association can get into, as well as getting out there and helping school boards that are still struggling with workplace violence. One of the problems that we face, all school boards face in workplace violence, is when it comes to special needs students. Under Safe Schools legislation, you cannot suspend or exclude them because of something called mitigating circumstances, because the student or the child may not know the difference between right and wrong based on their disability, and so you can't discipline them for that. When it comes to workplace violence, under the Occupational Health and Safety Act, it supersedes. So if that child presents a hazard or has done something that meets the definition of workplace violence, you have to remove the threat till you can implement steps to prevent a reoccurrence and make safe before they come back. So that is a huge culture shift and a change on thinking for educational institutes. And that is where a resource such as Public Services Health and Safety Association has the experience and the background, the knowledge, and the tools to come and assist school boards in understanding that and growing the health and safety culture in the workplaces, not only for workplace violence, but beyond that into many other topics.